I had trouble reading and writing. I had that all my life. I had a hard time in school.
I began using cocaine probably the age of 18.
Going outside and work, I can't do it because people make fun of me, and then I get embarrassed. And
you know, I have a daughter that I need to be a role model for.
People are mean. They call me retarded, and they call me stupid.
My life was just like no good.
So I can understand who I am, what I am.
My son has tuberous sclerosis, which are tumors that grow in the brain, and it has caused learning disabilities for him.
I had a lower back injury.
And I didn't know where we were going to be able to get help.
When I came here, I was really depressed.
My son comes to Centerstone because he has behavioral issues. He was very depressed because his father wasn't around.
I used to be sad.
I am addicted to speed.
Very abusive towards me.
I have been taking it since I was like 18 years old.
I had to call the cops on him 3 times. He chased me around the house with a knife.
My body basically started deteriorating, and I started getting depressed.
For 47 years I've tried to kill myself in one way or another.
And it basically took over my whole life.
I wanted to die so much.
And my depression was so that I didn't even want to live.
I went to my doctor's office one day and he asked me how I was, and I told him if I had a gun I'd kill myself.
Quite honestly, I didn't think anybody really cared.
My family doctor sent me to Centerstone.
My family stepped in and said something's got to give, and I was calling around to all these other places, and
I felt like there was some hope for me.
Centerstone was the one that called me back, so that means they must have cared the most, and here I am.
It was just a little bit of a glimmer.
I chose Centerstone.
But that glimmer grew into a big light.
I chose Centerstone.
I chose Centerstone.
I chose Centerstone.
Centerstone is the largest community provider of mental health and addiction services.
Our job is to help people who have serious illnesses recover from those illnesses and function at the highest level possible.
To prevent and cure mental illness and addiction.
Centerstone, like all organizations, has mission statements and vision statements, but at the end of the day, we're about changing people's lives.
Centerstone today is a merger of 3 nationally recognized community mental health centers. Coming together, we bring the experience of generations of leaders in community mental health and addiction services.
See tens of thousands of people across multiple states.
This gives us stability. It gives us sustainability. Our communities, our clients want to know that we're going to be there for them for the long term.
Our size is an advantage for a lot of reasons, research and other things. It gives us lots of opportunities to do things that other organizations can't do.
In spite of the large number of clients and families that we serve, every client is treated as an individual.
Research and information technology are 2 of our strengths.
That means that those services are the most effective treatments available right now in America. Centerstone is there for everyone who needs us. Our focus in helping people is first to give them hope, that whatever brought them here, whatever their circumstances were that brought them through that front door, that they are in the right place, that they are seeing gifted professionals who know what they're doing, who have the best training, the best resources available, the latest research.
The people that work at Centerstone are among the most committed I've ever seen. They could choose to go elsewhere. They could work at other places and maybe making more money, but they don't. And the reason is people are committed not to just the job, they're committed to a mission.
Because of the quality of our services, the convenience of the locations that we have, clients come to Centerstone from all over the state of Indiana. More and more of our services are being provided out in the community. Working with primary care physicians, hospitals. We have therapists placed in the schools. We also have a number of clinics that are walk-in clinics. Individuals don't need an appointment. We have crisis capability 24/7. Centerstone is always here if you need us. Our communities really rely on us to provide the kind of services that build resilience in families, that create recovery. There is a door out, not just a door in. that we are putting people back out into the communities in a way that they can serve those communities and be productive citizens. Our clients are not coming here to be taken care of, they're coming here to get well.
When people think about a place like Centerstone, the first thing that comes to mind are mental disorders and substance use, and that clearly is a large portion of what we deal with. But in truth, we are about health care.
Throughout our country, there is a growing awareness that we cannot be physically healthy if we're not psychologically healthy. We know that nearly 60% of individuals who go to see a physician do have some sort of psychological or addiction issue.
The success rates for treatment of depression are above 80%. The success rates for treatment of panic disorder, 70 to 90%. Success rates for treating schizophrenia, 60%. Now, how does that compare to a physical disorder? Treatments of heart disease run 45 to 50%. We are doing some cutting-edge things to determine what works and what does not work. I mean, that's really the fundamental question. We are doing things to change the way healthcare is delivered in the United States now that arguably nobody else is doing. We know that the changes that are happening in neuroscience, in biology and chemistry, are going to lead us to opportunities to actually cure mental illness, and I think it's time.
Everyone associated with Centerstone, folks who choose to come here for services, those who provide the services, communities in which we provide those services, and the donors that support what we do, all chose Centerstone for very specific reasons. Clients and families choose to come to Centerstone because of the quality of our services and the research that backs it up. Employees choose to come to Centerstone because they have the opportunity to do the most meaningful work one could imagine. Community agencies choose to partner with Centerstone because our addiction and mental health services are a key component of the health of every one of our communities. Donors choose to give to Centerstone because through their gifts, we can truly prevent and cure mental illness.
I chose Centerstone.
Centerstone is not just a job.
It really comes down to people that help people.
It's a calling.
And I'm really proud to be a part of that.
Centerstone provides for me an opportunity to make a difference in people's lives.
I chose Centerstone because here the staff is awesome, the classes are nice.
I chose Centerstone because it makes me happy when I see other people happy.
It is nice to have somebody listen to you all the time.
I chose to work at Centerstone because I believe in giving people hope.
I chose Centerstone because it's willing to go beyond the standard clinical intervention and do whatever it takes to create a sense of purpose in the clients that it serves.
To help children wake up in the morning, put a smile on their face, give them something to believe in themselves.
That's why I chose Centerstone.
I chose Centerstone because I wanted to better myself and become part of the community again.
I wouldn't be the person I am today if I wasn't coming to Centerstone. It gives me the tools to help me be a better father to my kids.
The reason I like serving on the Centerstone board is because I'm with a group of people who really care about people.
I don't know what I would do without Centerstone.
I chose Centerstone because they help me have a better life.
We are very happy that we chose Centerstone.
I chose Centerstone because Centerstone offers hope.
Knowing that there was a program out there for my son that can help him in a way that I know that I could have never helped.
I chose Centerstone because I want to make a difference.
I heard many good things about this place, and I knew that they could bring me and my son back together.
I chose Centerstone.
There are many, many things we can do here that can't be done anywhere else. This is the job I've trained my whole life to do.
I chose to be where I feel wanted and needed.
When all you want to do for 47 years is die, and in a year you find hope at the end of that year and the ability to want to live instead of die, Centerstone to me means life.